Welcome back to the All Things Plastics podcast. Today, I am thrilled to welcome Dr. Samuel Golpanian, a board-certified plastic surgeon based in the heart of Beverly Hills. Born and raised in New York, Dr. G trains at some of the most prestigious institutions in the country, from med school at SUNY Downstate to residency at the University of Miami's Jackson Memorial, and finally, a competitive fellowship at Temple University. With over 4 years of private practice under his belt, Dr. Golpanian has become known for his signature work in lipo, body contouring, and full mommy makeovers, helping both post-childbearing moms in their 30s and 40s and prepartum women in their 20s feel more confident in their skin. He's not just an artist, he's a surgeon who gets it. So whether you're prepping for pregnancy or reclaiming your body after motherhood, this episode is for you. Let's welcome Dr. Samuel Golpanian to the show. Dr. Golpanian, welcome to the All Things Plastics podcast. I know you just got out of the OR, you had a full day of surgery, but thank you so much for coming on the pod and talking to the girls and going to give some good insight today.
Thank you for having me. Really happy to be here and talk about lots of things related to plastic surgery and educate patients and non-patients alike.
Yes. Now let's start out. Where were you born? Where were you raised? And you're a New Yorker turned Beverly Hills plastic surgeon. Yeah. Take us on that journey.
I was born in New York, specifically Long Island, New York, and then I did my training in SUNY Downstate for medical school, and then University of Miami for surgical residency, general surgery, and then I went to Philly for my plastic and reconstructive surgery fellowship. So I think Beverly Hills is, somewhat similar to New York and Miami mixed, and so I thought it was a good hybrid to kind of move out here. I know it's a mecca for plastic surgery, so for me, Beverly Hills kind of fit all the boxes, or checked all the boxes.
Yeah.
And that's what brought me out here.
And what drew you specifically to plastic surgery versus like all the other surgical fields?
I think plastic surgery allows one to not only be artistic, but you're working on different parts of the body daily. You're really recreating things for patients physically, but emotionally and mentally as well. And so, I deal with a lot of patients who are moms, had pregnancies, and for them, they're looking to look better, but the real end goal is to feel better and really regain that confidence they once had.
And we're definitely going to get into the mommy makeovers and all the snatchness, but we are first going to talk about something that always comes up. It's always super viral, Miami versus Beverly Hills. Now, I know I trash on Miami a lot, and I try not to, I really do, but we just hear so many horror stories about Miami and all the practices and surgeons out there, and you used to operate in Miami. Yep. How would you compare Miami versus Beverly Hills when it comes to the plastic surgery culture?
I think Miami's a great place to live, love the weather, love the beach, love the nightlife, and there are surgeons out there that do great work. It's not to discredit any of them, but unfortunately there is a lot of stuff that goes under the radar.
Yeah.
I call it the Wild West. So there's a lot of things that happen. For example, surgical techs that are doing surgery when they shouldn't be doing surgery. They're not even doctors.
So crazy.
Running multiple rooms where the surgeon's actually maybe just sipping some coffee, looking at the rooms, making sure that everything's okay, but it's not really them performing the surgery. The type of anesthesiologist, the list goes on. So I think that again, it's a great place. You can find great surgeons, but there's some stuff that does not really shouldn't fly, and it happens.
Yeah, and I feel like I call them like kind of chop shops. They come up, and as fast as they come up, they come down, and things fly under the radar. And we just hear so many sad stories. And I feel like Beverly Hills, yes, everywhere has their good and their bad, right? But I feel like Beverly Hills, we're the capital of plastic surgery. I feel like we take things a little bit more seriously, right?
Yeah, I think it's related to a number of things. It has the name, of course, but there's a lot of plastic surgeons out here in a very concentrated area, and people come here to get the best care. And so, you really have to keep up to par with, the prices that you're selling surgery for, and the care people want when they travel out here. And
would you say, touching on prices, we see all these like lipo BBL deals, like come in now and it's, I don't know what, $8,000 for your BBL lipo, like that's like a red flag in itself, right? Like all these like low deals, and they can get you in, they can get you out, like huge red flag.
Yeah, definitely. I think pricing is related to not only the surgeon's fee, it's related to operating room fees and anesthesia fees. And so I always tell people, if it's really cheap and it's too good to be true, then it's too good to be true. There's a reason.
Yes.
Because they're doing the surgeries at a very fast-paced manner, maybe paying some staff that shouldn't be there doing the surgery, and that's really what's causing the prices to be so low. So it's not all that glitter and gold that you're seeing.
No. Now, what I noticed too, especially online, is the procedures that women ask for. I feel like one city is more snatched than the other and one's more natural. I would say Miami is that video vixen, big boobies, big booties, and where Beverly Hills, LA, we're more going towards like the it natural girl, natural enhancements. Would you say the same since you operated in Miami?
Yeah, well, I didn't technically do plastics in Miami. I did general surgery in Miami, but throughout my training, I did see a lot of the results from other plastic surgeons, whatever would come to the ER. Again, there's great surgeons out there, but the majority of patients that go there go for the price, and many times it attracts the type of clientele that does want that aggressive,
Look,
fake
aesthetic.
look. Yeah, so I think the doctors there are trying to deliver what the patients want. At the same time, the patients that go there are telling them, hey, I want you to be as aggressive as possible, and they're being as aggressive as possible. It's not always the best thing to be aggressive as possible because it's not only affecting results, it could affect safety.
Definitely.
And so, yeah.
And rules out here, we don't pull out more than 5 liters during liposuction?
Yeah, it's
roughly.
It's somewhat of an arbitrary number based on the state's regulations. So, for example, California is 5 liters. That's including the fat as well as the tumescent fluid. So it's not just pure fat. In Florida, I believe it's 3 liters. If you do it with a tummy tuck or a BBL, it's 1 liter. But
it's only 3 liters in Florida?
Yeah, I think the limit is 3 liters. But
they're doing way more than that.
Yeah, don't quote me on that. The numbers may have changed. But every state has its own regulations. Many times it's not written by physicians or let alone surgeons. So you have to take it with a grain of salt. But I actually did a paper a few years ago on high volume liposuction, and there's a way to go about it in a safe manner, and we're kind of trying to change the paradigm on how much you can take and how you can take it safely. So, And
I think patients need to be aware of that because we got a lot of patients with high BMIs and they come in and they're looking for these unrealistic results, and then they're complaining on the Facebook groups and Reddit, my surgeon didn't even snatch me and they didn't take out that much fat, but they're not aware that you guys do have restrictions and those restrictions are in place for their safety.
Yeah. That kind of makes me think of expectations. So expectations are really, really important, and I think it's very important for surgeons to be fully transparent with their patients.
Yeah.
I would rather under-promise and over-deliver than over-promise and under-deliver. So you really got to let patients know what to expect and not try to kind of, embellish things. Yeah.
Yeah. Now, we're talking about surgery. Let's talk about recovery homes and kind of like operating environments. What are some major safety differences you've noticed between the two markets, like Beverly Hills and Miami, especially around recovery homes and operating room environments?
Yeah, I think in Miami, as you said, the word chop shop is very, very loosely thrown around, but I totally understand where it comes from because patients come, they fly in from other parts of the country, even out of the country. I honestly think Miami is in some ways like the TJ of the U.S. People are traveling there. It's a travel destination for plastic surgery, but cheap plastic surgery. They come in. I've heard of patients flying right after surgery. I think that's crazy. It's ludicrous. It's unsafe. Recovery homes are not very... they exist there, but it's very, very uncommon.
It's in like a gray area. There's not a lot of laws. No one's really checking in. Yeah. People are looking at it like a money grab. Like we can charge $2,500 a night and just have these girls lay there and give them their meds. And it's sadly, it's more to that. And people are dying and it's scary.
Yeah.
All these TikTok stories we're hearing and girls dying and just because they're trying to save some extra cash. It's really sad. Now, do you think that patients in one city are more educated than the other or better prepared going into surgery?
I think that it's hard to kind of give a black and white answer to that and say all patients that go to Miami are X and all patients that go to LA are Y. But for the most part, the ones that are willing to spend a little bit more and go to Beverly Hills, they've done their research. They've shopped around. They know what's what. And I think they're a little bit more educated in terms of kind of doing their homework. And they're okay with it. They want to do it once and they want to do it once the right way.
Yes. And touching on a story, I just interviewed a girl last week, Miss Stephanie. Her story is crazy, and she wasn't in Miami, but she was in Atlanta. But to touch base on this, she went to Mia Aesthetics, and pretty much that's a well-known plastic surgery corporation, and I call it a chop shop because they literally did her consultation, asked for her photos. She had questions. They did not reply to her emails or call her back until the day before surgery to finalize booking, and she did not know any post-op requirements or what she needed to do, and she did have complications after surgery. And I feel like Atlanta, Miami, these surgeons are so focused on the operation, the surgery, and they're not focused on the after results and taking care of their patients, where here you guys go through a thorough process of like, hey, okay, here's what you need to do, here's your treatments, here's your post-op, like you guys check in, you guys follow up. It's just way more thorough.
Yeah, it's interesting you bring up Mia Aesthetics because I've been there. I haven't worked there, but I kind of toured the place when I was in training, just to kind of get an idea of
Ooh.
what goes on in these types of places in Miami. When I was job searching before I started my own practice, and it really scared me because, like you said, the way things are handled, I didn't really get to see the communication side of it with patients, but in the actual operating room, the things that go on there, looking back in retrospect, are a little bit like horrific. So it's hard to kind of pinpoint what they're doing wrong, but
Do you think they're just so busy because their marketing is so good,
Well,
their prices are so cheap, they're drawing patients in, and they're just way overhaul, too much for them to handle, and they're just in and out, in and out, in and out.
absolutely. I think there has to be like a balance, right? You want to be busy, you want to bring in lots of patients, but after a certain point, you're kind of going downhill with quality of care, safety, and many times legal issues when these things don't go the right way.
Yeah, definitely. And I definitely think that's a key factor. Poor communication. They're taking on too much they can handle. They're trying to grab all this money. And I think that's going to be the downfall of them. Because if you have enough patients complain, especially now patients are going on podcasts and TikTok, and it's going to ruin business for them.
Yeah.
Ugh. Now, no more Miami talk. We are going to talk about your mommy makeovers. And this is one of your most requested procedures, right?
Yeah.
And what does a typical mommy makeover include if, some of the girls don't know?
Traditionally, mommy makeover is an umbrella term used for what moms, can benefit from after pregnancy. Almost always includes a tummy tuck. Many times breast lift, breast augmentation with a lift, breast augmentation alone. But more recently, we've been doing fat transfer to the buttocks, fat transfer to the breast.
Yeah.
So I think mommy makeover is 2 or more major procedures post-pregnancy to kind of, tighten everything up and make patients look how they looked or similar to how they looked before pregnancy.
And how far after they give birth is it safe to kind of get that mommy makeover? How long are you telling your patients to wait and come back?
It depends where we're operating on. When it comes to the breast area, I like patients to stop breastfeeding for at least 3 months, and then we do the breast procedure. If they're not working on the breast, if it's a tummy tuck, I would say 3 months as well from the time they gave birth.
Oh, okay. 3 months is good. I was thinking like it was 6 months, but
It depends on the patient as well.
course.
If they sound like they're a little bit more on the stable side and they haven't really fluctuated for the past 3 months, I'm okay with that. Some patients may need about 6 months, but I think more than that is a little overkill.
now what's your take? Say a mommy gains, I don't know, 40, 50, 60 pounds during pregnancy, and she wants to get that mommy makeover like right away. Like, I want to get on the table, I want to get snatched. Do you think it's better that they wait it out a little bit longer and try to lose as much weight as they can postpartum and then come back so the results look better? Or what's your take on it?
I don't think that they need to lose as much weight as possible because everyone's going to plateau at a certain point. I think it's important for the patient to know where their pre-pregnancy weight is and what their goal is, and to kind of get close to that number, but importantly stay at that number, stable at that number for 3 to 6 months. So even if they lost 20 pounds and they're close to their pre-pregnancy weight, but they keep fluctuating, plus or minus 10 pounds every month or so, then they're not stable at their weight. They need to kind of be plus or minus 5 pounds for a good 3 to 6 months.
And I mean, so you're not wasting your time, you're not wasting your money, and you don't have to come back. Do it right the first time. Make sure you're at that stable weight.
But you don't want those results to be ruined.
Yeah.
Basically.
Now, what do you wish every mom knew coming in before a consultation? What do you see a lot that at the consults that maybe was a myth or they thought something else?
I think for me, it's letting them know that my job is literally 20 to 30%, and the patient's job is about 80%. And it's kind of hard for a lot of patients to hear because in their mind they're like, "Well, I'm paying all this money.
You need to fix me up.
Yeah,
you're a magician."
But a lot of care has to go into the postoperative journey to really make sure you're doing the right things and not doing the wrong things, and just making sure that you're progressing the right way so that you keep those results, you don't ruin those results.
Yeah.
And for these patients to have patience, because it's very easy for people to be perturbed by their results right away. Oh my God, there's a lot of swelling, or oh my God, this looks a little too red. It's a process, and you have to trust the process and be patient and do your job as well.
People assume they get on the table, they go home, and they're going to have this light hourglass snatched figure, and reality is it takes a couple months. You're not just going to go home and be ready to go looking snatched for summer.
Exactly.
And I think, social media and a lot of surgeons, we're touching base on this more, and it's a process. The whole surgical process is a long process, especially recovery. And I feel like we're making headway. More patients are becoming more aware.
Yeah,
we're giving realistic, what to occur. Now, speaking on the recovery process, what are some of the biggest mistakes that you see your patients, specifically moms, making after surgery? Especially like probably they're trying to jump back into parenting too soon or take on too many things, or what do you see that you're like, oh, like I wish you didn't do that?
Again, it depends on the procedure, but I feel like a lot of patients beyond the 2 week mark, they're like, all right, well, I'm back to work, my trains are out, and they kind of go back to normal stuff. Maybe they're not lifting really heavy weights, but they're just going back to normal stuff. They're getting in the water, they're using new creams, new soaps, and I tell patients to take it easy. On the flip side, there's a lot of patients that don't prepare well enough for surgery, so they don't get the right, whatever it is, equipment.
Post-op supplies, supplements, everything.
When I do like tummy tucks in a BBL, I don't have them on their stomach right away. You shouldn't be because of the tummy tuck. So what can you do to prevent pressure on the buttocks? I have a lot of them get these air mattresses with the holes to accommodate the buttocks and the hips, so there's no pressure to it. A lot of them just kind of hear it, and for whatever reason, they don't want to get it. And then
no, the girls want to preserve the booty more than the tummy tuck scar, and it's like, sis, the tummy tuck incision is way more important than the booty. Like, I get you want a big old booty, but no, there's so many complications, I feel like.
If you're not taking care of it, if you're not showering the right way, if you're not applying whatever cream is prescribed to you, a lot of things can happen, especially small little wound infections opening up. So you got to really be very cognizant of what's going on every day.
And I feel like we try to tell patients that the surgical process and the recovery process start before surgery. It's not like the day after surgery, okay, I'm going to start eating right, or okay, I'm going to start to go to the gym, or okay, I'm going to start to take my supplements. Like, you got to start getting in these good routines and habits before surgery so you can actually follow through with them.
Yeah, it's a good way for you to practice and get used to it and kind of make it a lifestyle and a habit so that it's easy breezy when you get the surgery and you make it and incorporate it into your life.
Yeah. And do you have any go-to tips for moms with young kids on how to plan realistically for the recovery? Because I know surgery is expensive wherever you go. It's a couple thousand no matter what. And a lot of moms don't want to get a hotel or get an Airbnb or go to a recovery home because, an extra $2,000, $3,000. It is a lot, but then they go back home and they have young children and their kids are saying hi to mommy and jumping on them, and then they're asking them for this. Like, realistically, I know you want to be in the comfort of your own home, but it's hard.
I mean, if you're not home and you're in a recovery center, you're most likely not going to be with your kid. You're going to have someone taking care of them at home, whether it's a babysitter or a family member. But those who go home, I always advise them to make sure they have surgery at a time during their, by which their husbands, for example, can take off for work so that their husbands can be taking care of them, taking care of their kids. If their husbands are not available, if they don't have a husband, whatever the case may be, a family member, their mom, their sister, their cousin, and if not, their best friend. So someone that you trust to kind of be there for you and to be there for your kids to kind of help you, because you're going to need that help after surgery.
Definitely. And, getting the mommy makeover and having small children at home or any children at home, you kind of have to plan ahead way more. It's not like anyone single going to go get surgery and you go home and recover on your own. You definitely have to plan ahead with food, school pickup and drop off, babysitters. When you have to go to your post-op appointment 3 weeks later, who's going to take care of the kids? So you guys really have to plan ahead to make sure you have a smooth and stress-free recovery process. I know it's hard to say, every patient has their own journey, everyone's recovery process is different. How long typically, everyone take this with a grain of salt, is the recovery process for a mommy makeover? Roughly like, okay, I do have to go back to work, Dr. G. When could I go back? If everything is perfect. Perfect world.
I think you're safe at 2 weeks.
Okay.
There's some superstars that can do it as early as 1 week, which
Damn.
is rare. I think definitely 2 weeks, and some people can take up to 3 weeks.
Wow. And I've seen patients recover their first week post-op. They think they only need help for 48 hours, and it's like, getting in and out of bed, getting in and out the car, going to your treatments. The first week of recovery is tough.
Yeah, it is. The first week is the toughest. By the second week, it's better, but it's not gone. And then that's when patients usually can go back to work and go back to activities of daily life normally. Drains are usually out. They're not taking any more narcotics, off antibiotics, things like that.
And what do you say when patients, because everyone is scared of drains. They hear drains and they're freaking out. They see them, they see the blood and they're freaking out. I love drains. I think they're very beneficial. They prevent a lot of complications, hematomas, seromas, all that stuff. But what do you kind of tell the patients when they come in and they're like stressing about these JP drains?
Well, first of all, I tell them that, after a few days, you're going to be very used to the drain. You're not going to even think about it. But importantly, they should be more scared of, like you said, a seroma, where now they have almost like a water balloon on the inside filled with fluid, and they have to come back to the office and have a needle poked into them to drain it, and maybe come back a second time, even a third time, because seromas can recur and come back. So this is the best possible way to prevent them.
Definitely, I don't want patients to be scared of these JP drains. They really do help a lot, and they're so easy to use. Like, they look scarier than what they actually are.
Yeah.
What do you say to moms who feel guilty for getting plastic surgery, spending all this extra money on themselves and taking time away from their kids? I hear a lot of moms that are like, well, I don't want to go under anesthesia, or I don't want to spend this money. And what do you kind of tell them in the consultation when they're really hesitant?
Listen, we all live a life, and we're here to enjoy this life and to make the best of it. And I always use the analogy of the plane. When you're on the airplane, they say, put on your mask before you put it on.
Anyone else?
Exactly. So, yeah, you can take care of your kids and your husband and your family and feel guilty all you want, but at some point, you need to take care of yourself. And by taking care of yourself, you'll be better able to take care of those around you.
Definitely. Let's talk recovery treatments. Do you kind of recommend your patients go to maybe hyperbaric, go get IV fluids, go get red light therapy? What are some of the treatments to even enhance and maintain those results after surgery?
Yeah, that's a great question. I love hyperbaric oxygen chambers. I think they work great.
And explain to the girls what hyperbaric is, because some people are like, what the hell is that?
Yeah, it's basically a chamber that one lays in and breathes in high concentrations of oxygen, almost 2 or 3 times atmospheric oxygen. And what that does is it promotes tissue healing. It gives more energy to patients post-op. It helps with swelling, bruising, theoretically an improvement in the fat cells surviving in the first week because there's no blood vessels at that time. So it does wonders. Patients love it, and I think it's great to kind of prep your body with 1 or 2 sessions before surgery, and then do another 3 to 5 sessions after surgery. Lymphatic massages is one of the things I always talk about. I always emphasize. Those are gonna, not only help patients with pain, but prevent fibrosis, prevent cellulitis, allow all that tissue to really heal properly.
And touching on, with hyperbaric, really quick to touch on that, if people with like diabetes, say, mommies have diabetes, going to hyperbaric really helps to heal those incisions even faster, because you do have a delay in wound healing when you are a diabetic.
Yeah. Every surgeon has their threshold under which or over which they're not going to operate on a diabetic patient. But anyone who has a history, even if it's well controlled, the hyperbarics does allow that tissue to heal in a stronger fashion. So if anything, it helps with diabetic patients just as much, if not more, than healthy patients.
And it's pretty cool. You girls can go, you can sit in one, you can lay in one. They have a TV playing for you in there. It's like an hour session. You don't even know what's happening. You just sit in there. You could be on your phone. But it's definitely really beneficial. We see so many good outcomes with hyperbaric.
Yeah.
And touching on lymphatic therapy, what I've been seeing a lot is another quick cash grab. A lot of not certified lymphatic therapists specializing in post-surgery massages and also training other people. What the hell? Do you tell your patients, you need to make sure this massage therapist is certified?
Yes, I tell them they have to be a licensed lymphatic masseuse. And that's because, anyone can give a massage, right? Couples do it all the time when they're in bed.
Yeah.
So it's not the same as a regular massage. It's not a deep tissue massage. It's actually not deep. The lymphatic channels are right under the skin in the subcutaneous space. So there are techniques that these masseuses use to really get those lymphatic channels working and draining all that fluid back to the heart out of your body. So it's really important that you go to someone who does this for a living and not just anyone.
And I've seen this, a lot in Miami, them using tools and instruments and wood therapy post-surgery and going at it. What the heck?
Yeah, I'm not too familiar with every device that's used. I've heard of and I know about wood therapy.
Yeah. But post-surgery, your first couple massages going crazy?
Yeah, no, that should be usually used beyond the 4 to 6 week mark.
Yeah. So definitely your girls need to make sure that you are going to someone who's licensed. And a lot of surgeons will refer you to a lymphatic massage therapist. They might have a handful, or their nurse might. Try not just to pick somebody off Groupon or somebody that is doing $70 massages. Do your research. As much as you do your research on a surgeon, you also need to do your research on a licensed lymphatic therapist, because they can also jack you up.
Yeah.
Very easily. You don't want to spend all this money and time. Your surgeon did great results, and then you go to a lymphatic therapist and you're running into trouble.
Exactly.
What are the biggest mistakes you see with patients during recovery that you wish you could prevent? People are coming in and you see them after surgery 1 week, 2 months, 3 months, whatever, and you're like, you guys, what are you doing?
Incision care. I see lots of patients, they're not keeping their incisions moist. I like to keep it moist with Aquaphor, Bacitracin, different things like that. they're applying it once, they're putting a bunch of gauze on top of it, which is unnecessary. It kind of wipes away everything that you're trying to leave there.
They're scared to touch. When I talk to these girls, they're scared to touch their incisions. They rather not touch them and not do anything than even mess with them.
And that happens a lot with the belly button area, right? They don't touch it. Even when they shower, they don't clean it. And all that dry blood crusts up inside the belly button. It can become infected. It just, a lot of bad things can happen. So you really have to kind of just take a big step forward, take a big deep breath in, and
put your big girl panties on.
You got to manage your incisions. You got to manage your post-op care.
If you were a big girl and you went under the knife, you need to be a big girl and manage your incisions and your drains.
Or a big boy. Yeah.
Or a big boy, that too. Yeah, that's definitely one big thing is incision care, because God forbid you get an infection and you don't know how to control it, or say they flew in from out of state or even out of country to see you, and then they see you for their 1 week and then they fly out and they're not following up with their incisions and they get an infection, then what? You're screwed. Because then you have to go to a random ER and have them try to prescribe you antibiotics and do all this wound care, and you run into a lot of trouble if you don't properly do your wound care and do your incisions.
Yeah, that's true.
Yes. Now, Dr. G, anything coming up for you in 2025 in your practice, or what you're focusing on more, or what clientele that you would like to get?
Like you said, I do a lot of mommy makeovers. I work with a lot of patients who are in their 30s, 40s, and even 50s who are post-pregnancy. I would say that's about 60 to 70% of my practice. The rest are younger patients who are, single or pre-pregnancy.
Yeah.
But my goal is really to kind of attract younger patients to make that a little bit more of my practice as well.
Yeah.
I think that liposculpting is really, really in. It has been in. You don't have to look exaggerated. You don't have to look unnatural.
Yeah.
You can kind of take the fat away from stubborn areas and really reshape your body to a look that you want without looking fake.
Yes.
And a lot of younger patients, I think it's a lot easier to do those surgeries, because doing it on the post-pregnancy women who are, let's say, a heavier set patient, or they have a lot of skin hanging and a lot of diastasis or muscle separation, those are trickier and more complex to perform.
Definitely.
But the younger patients who haven't had pregnancies, who don't have muscle separation, things like that, they're a little bit easier to perform, and they look great after surgery as well. So I'm trying to attract those types of patients as well.
And how do people go ahead and book a consult for you? Because I know biting the bullet and going to the first consult is so scary, but you guys are very welcoming. Everyone's so nice. How do they go about getting in touch with you and coming in and just kind of seeing what's out there for them and what you can do?
Yeah, there's different avenues by which patients can contact the office. Obviously, one is telephone. And a lot of patients call the office, 424-383-8111. But the other way is through Instagram, WhatsApp on the website. And on the website, there's a request consultation form. So lots of people go on these different platforms and request consultation. And then we have our patient coordinator reach out to the patient and kind of go step by step with the consultation, quote, and how the whole process would work before they even come in for the consultation. Oh,
okay. And what about the girlies that are out of state and out of country?
I have lots of out-of-state patients or patients that live, Northern California.
Yeah.
Those patients, same thing. They request a consultation. They speak to Bria, our patient coordinator, and they just kind of get an idea of how long they should be in town and have everything set up well beforehand, so that if they want surgery in, let's say, 6 months, they do their consult within 30 days of that date and have everything set up beforehand.
And, talking about pre-surgery, what are the things that you require in your practice for patient safety? Your labs, your EKGs, all that stuff. What do you typically make sure that the patients have prior to getting on that table?
Yeah, even if a patient's healthy, baseline I get on all patients: medical clearance, labs, EKG. If they have other medical problems, then we look into it further. I either refer them to someone before undergoing surgery. But we do all that well before the surgical date, just to make sure everything is good.
And typically we require them 30 or 60 days?
I require 30 days.
30 days. Yeah. You guys have to have everything done and make sure you're cleared and healthy for surgery. I know a lot of patients, especially in their 20s, they're like, well, I'm just getting lipo and a BBL. I'm healthy. Do I really need to pay to go get? Yes, you do.
Yeah, those patients many times may not know that they have some underlying
health condition,
disorder, or maybe they have anemia that was undiagnosed, and those things can be important with surgery. So it's really important just to make sure you cross your T's and dot your I's before undergoing elective surgery.
Definitely, and it's such a smooth process. You guys make it so smooth. So I know, you're very consistent with your social media platform, and you are very well known for your natural but noticeable results, especially your tummy tucks and the belly buttons. Tell us about that really quick and what the girls can expect to get with you when they ask for that surgery.
But I also look at pre-existing anatomy. So I look at what someone, many times I ask for photos, but sometimes I just ask the patient what they look like or what they wish they look like. And I kind of compare it to their anatomy before surgery. And I kind of get the best, for example, with liposuction. I try to make the areas that I know kind of got more fat deposits or changed with their pregnancy. That's what I want to address most.
Yeah.
And I don't want to overdo it because I don't want them to look like, fake.
Yeah.
But I want to kind of do it in a way where they look more symmetric, more confluent.
They're like an enhanced version of themselves.
Yeah. And the belly button, I think most patients want innies. So, the belly button kind of evolved with time. I tried a few different techniques. Some of them didn't work. Some patients complained. But it got to a point where I felt comfortable with a certain technique, which allowed me to create that innie that wasn't circular. It didn't have a thick scar around it.
Yeah.
It was nice, oblong, oval, vertical, and that patients like. So I'm very grateful for that. And I hope to provide more patients with those natural looking belly buttons.
Definitely, and I can vouch for him. I've been in the OR with Dr. Golpanian. He does some good belly buttons, so don't be scared, girls, because the belly buttons, we've seen some crazy ones out there, especially online. I've seen some girls, and I'm like, what the heck happened? What did the surgeon do?
I think for me, the belly button and the muscle repair take the longest. So
Yeah.
I spend the most time on those 2 parts of the procedure.
I mean, those are the important parts,
Yeah.
definitely. I mean, it's all important, but definitely the muscle repair and the belly button.
Yeah.
Well, Dr. G, thank you so much for coming on the podcast. I know you've had a long day in the OR. What'd you do today? Tell us what case.
The first case was lipo BBL, basal plasma.
Snatched or natural? What did she want?
It was natural.
Okay, a little natural BBL moment.
But noticeable.
Okay.
And the second case was lipo BBL, breast augmentation, and rib remodeling.
Ooh, she did the whole works. Snatched out here. Well, thank you so much and educating the girls and coming on. It was a pleasure to have you.
Likewise, thank you.
All right, you guys, well, tune in next week and we will talk to you then. Bye.